the hierarchy of evidence, systematic review is at the pyramid. It's a top. It's a top. That means all the information that you get from systematic review is probably can be taken as true. So that is from the base of the pyramid will be what is called as expert opinions. So expert opinions have very little credibility, even though professors think that if they say in my experience, then that may not be taken with the great level of evidence. So systematic review, we just wanted to give our students how to conduct a systematic review, and just it's a very tough exercise. So Saniya, our registrar, is going to tell you what is the process, what is systematic review, and what is the process of going through a systematic review to come up with a solution. Over to you, Saniya.
Thank you, sir. Good evening to Honorable President, Secretary, and all the members of Surgical Society of Bangalore. As sir said, today I am here to give a talk about systematic review and how systematic review is conducted, and we'll also see what challenges we are facing when conducting a systematic review. So my plan for today's talk would be, we will understand the different types of reviews and their purposes. We will see the special features of systematic review, and I'll give an overview of how a systematic review is conducted. Reviews basically are secondary form of, it's a form of secondary literature where you go through different articles and thereby come to a conclusion. They help you to synthesize information from several original studies. There are different types of reviews. First, we have the narrative or literature review, which provides an overview of what is known about a particular topic already. Then we have the rapid review, which aims to produce a rigorous synthesis very quickly, especially where there are time constraints or in case of an urgency. These rapid reviews are usually based on a predefined research question. Then we have the scoping reviews, which are usually exploratory and they address a broad question compared to systematic review, which usually addresses a targeted question. Then we have the umbrella review. This is a review of multiple systematic reviews. This process uses explicit and systematic methods to search for, identify the systematic reviews on the related research question. Then we have our systematic review. To define systematic review, it is a review of evidence on a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant primary research and to extract and analyze data from the studies that are included in the review. So why do we have to do a systematic review? The systematic reviews were developed out of a need to ensure that the decisions affecting people's lives were informed by an up-to-date and complete understanding of that particular research question. The topic that you select for a systematic review can either be on an intervention, on any diagnostic test, prognostic factor, or any other healthcare topic. The main aim of systematic review is to avoid bias. So what is a bias? It is a systematic error introduced into sampling or testing by selecting or encouraging one outcome or answer over others. There are over 25 different types of bias, which impacts the validity and reliability of the research that you're conducting. Systematic reviews in this matter, they occupy the highest place in the pyramid of evidence where they have very minimal bias. This is the pyramid of evidence where you see systematic review occupying the apex of this pyramid and expert opinion the base of the pyramid. This pyramid shows the different levels of studies and is based on the bias that is associated with these studies, wherein the systematic review is associated with very minimal bias. Bias can actually occur at every stage of the research study. Like I said, there are 25 different types of bias. Most common types are selection bias, observer bias, measurement bias, and publication bias. So there's something called as the PRISMA guidelines. It is expanded as the preferred reporting items for systematic review and meta-analysis. The PRISMA 2020 statement, it provides updated reporting guidance for systematic reviews and reflects advances in methods to identify, select, appraise, and synthesize studies. This is basically a 27-item checklist having different topics like your title, abstract, then the results and the outcome, everything. And each of these topics are associated with the checklist that has to be confirmed when you're conducting a systematic review. So this is an example of the Prisma 2020 checklist, where we have different topics like title, abstract, introduction and methods. And under these topics, we have the checklists which include 27 items that have to be completed during a systematic review. So basically, when you're conducting a systematic review, we have total 7 steps. First, what we do is select your topic of interest to conduct the systematic review. Then you conceptualize and create a protocol where you define the inclusion and the exclusion criteria, so that whichever studies need to be included as well as excluded from your review can be defined. And then you start searching for the studies from various databases. Then screen for the studies which are included in your topic and exclude which are not included in your topic. Then once you get the abstracts which are related to your topic, you go through the full text and appraise those studies, then abstract data from them, and then formulate and synthesize the results. So first step is to define your research question. For example, we are conducting a systematic review on this research question, that is the role of preoperative PET-CT in pancreatic malignancy. So here we've just defined the research question. Then we have to define the scope of the review question. And coming to the scope of the review question, it can either be broad scope, or broad focus, or narrow focused, which is based on which depends on many factors. Broad scope usually allows for a comprehensive piece of work but demands significant resources, whereas a narrow scope might be more manageable but risks finding very little information to produce a useful synthesis. So whenever you're defining the scope of the review question, whether you'll be using a broad focus or narrow focus has to be defined. And wherever possible, the style should be in the form to assess the effects of whichever intervention or comparison that you are dealing with for the particular health problem, in what type of people the disease or problem, and setting specified. Like you can see, we had defined our question as role of preoperative PET-CT in pancreatic malignancies. Now defining the scope of that particular review question, we have formulated the review question as to assess the role of PET-CT in preoperative phase of adult patients with pancreatic malignancies, with specific information on treatment strategy and outcomes. Next is the protocol development. Once the protocol is developed, it usually has to be very transparent, and explicit criteria for selection of studies has to be defined. It sets out the context and helps you to exclude the topics which are not related to your study. The explicit definition of your inclusion, exclusion and outcome criteria has to be defined before you start the systematic review. So defining the inclusion and exclusion criteria, they usually based on the review question that you have taken up. And if you have a PICO question, like PICO stands for patient, intervention, comparison as well as outcomes, you will have to define your inclusion and exclusion criteria based on that. And these criteria will also be based on how you plan to group the data for synthesis. The reporting of these outcomes is not usually used to decide the study eligibility. Now, searching for and selecting studies, you usually go through different databases and try to find which studies are related to your topic. Different databases that you go through are PubMed, DOAJ, Web of Science, Embase, Scopus and Google Scholar. Few of them may not be available. It is usually a two-step process. First, you will have to go through all the titles and abstracts in these databases of each of the references and decide whether or not the study described is related to your topic. This entire process is usually done by two different people independently. And second, once you have found out the abstracts and titles that are related to your study, you will take a closer look of each of these studies, that is the full text articles. And this addition information will help you to decide, after going through the full text articles, whether this is actually related to your study or not, so that whichever was unclear in the first screen can be eliminated at this stage. So these are the examples of how searches are conducted at different databases. Here we have used specific keywords like PET-CT, preoperative, pancreas and malignancy, and we used AND as a Boolean operator. This search was done in PubMed, this in DOAJ and this in Google Scholar. Then once we've got the studies, we have to assess the quality of the studies, which is usually measured by several metrics. The quality of studies as of now is beyond the scope of this presentation. So once the full text articles related to your study has been obtained, we have to start summarizing the study characteristics and prepare for the synthesis. Synthesis is a process of bringing together data from set of included studies with the aim of drawing conclusion. And recalculate, but meta-analysis is where you'll be recalculating statistics with collated data, but in systematic review, you'll just be reviewing all those full text articles. And synthesized data is then reported in a standard format. Then once you've got all the data, you start interpreting the results and conclusion. For continuous outcome measures, we have to define the summary, the results for studies using natural units of measurement. And when studies measure the same construct but with different scales, we have to interpret the standardized mean difference or use an alternative effect measure for if you're conducting a meta-analysis. Then developing a search strategy is an important aspect of systematic review, and it is an exhaustive literature search. The search should usually have a high sensitivity, that is, it should be created in such a way that search will retrieve all relevant articles within the research area, or at least give you as many as possible. With all these are all the steps of the systematic review that you conduct. Even with all the defined steps, we still have a lot of ongoing challenges with systematic reviews. The time usually required to complete a full systematic review, going through all the text articles, taking all the information and interpreting results, is often more than 2 years following the publication of protocol. And methodology for undertaking reviews more rapidly is developing quickly, and in this entire process is complicated and cumbersome. Thank you.
I think Saniya will give you an example how she did the systematic review of PET-CT in pancreatic malignancy in the later part during the paper presentation. I think hopefully then you will be able to understand to some extent what she spoke for so far. It's not an easy topic, it will be difficult, and she is going to exemplify it later. And one comment about your topic, sir, artificial intelligence and clinical practice, next generation robotics in thoracic surgery are expected to give you a virtual surgical procedure itself, which you can practice before going into the OT next day morning. But it does not give you the variables like the anesthetist, single lung anesthesia, the anatomy, adhesions, and technique of taking the stapler in. All those things will not be learned. You have to learn it actually on the patient. And for those who are interested to read about artificial intelligence and how it's going to affect us, the best author I know is Yuval Noah Harari. He is the author of the best book called Sapiens, Evolution of Human Beings from Homo erectus to Homo sapiens. He has a lot of talks on YouTube about artificial intelligence and human beings. Worth listening to some of them. Thank you.
Thank you, Rajshekar. That was. Now I think I would invite all the postgraduates to kindly ask questions regarding this systematic review and also artificial intelligence. Any questions? We will. Don't think it is. Please, any question? See, the reason for every teaching session will have clinics or problem based learning and things like that. But these things, statistics or and studies, these are usually not taught to us. So we thought it will just give you a start and a flavor as to how systematic reviews are conducted and what is the essential difference between systematic review and meta-analysis. So Lakshman sir, would you like to just elaborate on the essential difference between meta-analysis and systematic review?
Put it very succinctly, the difference is in calculation. In systematic review and in meta-analysis, the search is the same process. It's not different. But then in systematic review, you just take the summary of all these papers that you have chosen for your review and summarize the summaries of all these papers, and you will get a practical flavor when Saniya is going to show it to you. You go one step further and pool the data of all these papers. If you have one systematic review with say 1,000 patients, you have five such papers in your systematic review. You can have 5,000 data on 5,000 patients and rerun the calculation, rerun the statistics, and that gives you much more authentic information than individual statistics run on each of those studies. So meta-analysis is a redoing of the statistics on pooled data, whereas systematic review gives you only the summary without further statistics.
Yeah, I
That-
think that was.
Answer?
Yes,
That-
Venkatesh.
that's- Saniya, very needful for the postgraduates where I think paper is a mandatory. You are asking a question? Please. We'll share numbers of Saniya. She is your senior, BMC.
Sania, you want to take that?
No, there is no cutoff limit. You just go through the different databases and search, and as many as articles possible, you have to go through them.
You can
can
limit
conduct a
the
search.
time period. When you are searching, if you get too many articles, say 200, and if you want to limit your search, if you put articles from 2000 onwards, that automatically limits. Time frame, you can use it as a limitation if you want.
Number of articles you harvest with your search depends on the topic. If it's a very unusual topic, I have seen systematic reviews with only 5 papers. And one of the things they mention in the summary is that there are very few papers and we need more papers on this. So that will be your summary, that will be your systematic review.
Any more doubts? I think all of you have got Lakshman sir's number and Saniya's number.